Good morning, everyone. Buenos días a todos. Bienvenidos. Welcome back to the Health and Wellness Committee's Wellness Wednesday initiative. My name is Jacqueline Munguia, and it is my great pleasure as a board member of your local chamber and the co-chair of the Health and Wellness Committee to moderate this event and welcome you in joining us today as we celebrate Minority Mental Health Month. Wellness Wednesday is an initiative of the Brownsville Chamber of Commerce Health and Wellness Committee, where each month the committee members feature select National Health Observances, highlighting important health issues that affect Americans every single day. During the month of July, the Health and Wellness Committee has chosen to highlight Minority Mental Health Month. As we all know, mental illness doesn't choose who's affected by it, but culture, race, gender, or sexual orientation can affect access to treatment, support, and the quality of care for so many. Today's program includes expert discussion by Belinda Tijerina and Mirna DeCos of Palms Behavioral Health. And this morning, I encourage all of you to take the opportunity to respectfully engage and ask our guest experts any questions pertaining to today's conversation through Zoom chat or on the Facebook Live comments section.
Our guest speakers this morning are from Palms Behavioral Health, which is a focused center focused on mental and behavioral health facility in the Rio Grande Valley community. Please help me welcome Belinda and Mirna.
Thank you so much. I appreciate y'all inviting us, being here. Thank you, Jackie and Kendra and Danielle, for setting this up. I am the Director of Business Development at Palms Behavioral Health, and I'm not the only one on. I do also have my community liaison, Mirna DeCos, who is just a valuable asset to the Cameron County, Brownsville community. So we're really, really excited to be here. Just a little disclaimer before we begin. We do have a Q&A at the end, and we're going to give you all of our services and a lot of the services we provide, and a look into how we can be a valuable resource for mental health situations, patients, anyone in the Brownsville area, anyone in the Rio Grande Valley. We not only service Brownsville, but we service patients all as far as San Antonio. So I'm going to start with a PowerPoint. Let me go ahead and share my screen. So again, Palms Behavioral, we are located at 613 Victoria Lane in Harlingen, Texas. However, again, as I've mentioned before, we do have patients as far as San Antonio, and we service the Corpus area, all the counties in that area as well. We go to Laredo, all the way to Rio Grande City, of course, all the way back to Brownsville, South Padre Island, Port Isabel, all the areas. So a little bit about our facility, our hospital. We are a hospital. We are a short-term behavioral health hospital, and that's really important because sometimes we have patients thinking that we are a long-term facility, but really we have a length of stay about 7 days. So it's behavioral, emotional, and psychological stabilization for patients that are in crisis. I know that right now that we have a lot of patients, or we have a situation right now with COVID that, and I know that that's why mental health has really become a focus in the community recently. And we've seen that not just nationwide, but worldwide. So a lot of that is, a lot of those situations, you know, with the crisis as far as economical and health, medical, it's caused a lot of fear. And so we, those patients that come to us come for emotional support and psychological stabilization for that reason. We are a 94-bed facility, and we do service adolescents, adults, and geriatric populations. So adolescents, we help from as young as 12 all the way to 17. And we do have a great program, not just for inpatient, but we also have outpatient services as well. We work with patients that have substance abuse, detox situations, and it is on a per patient basis. Partial hospitalization program is another part of our services. And again, like I mentioned earlier, outpatient services. So our outpatient services are for those that will come to our hospital daily. And we do also have services for students where they can come in half day, where they don't miss out on school. So half the day they are getting treatment, and half the day they are getting educated by an in-house educator, teacher, instructor. So what a lot of our criteria entails is a patient with suicidal and homicidal thoughts, those that are having hallucinations, delusions, self-harming behaviors. We have patients that can, that are mutilating themselves, just really, really, it can get really ugly. So, sometimes those situations, they need to have inpatient services. Severe depression, bipolar disorder, psychological concerns due to trauma, schizophrenia, anxiety, drug and alcohol abuse and addiction. In our geriatric population, we have sudden change in cognitive functioning, disordered thinking, and behaviors associated with cognitive disruptions. And why do we kind of specify this separately? Because you do have a geriatric population with Alzheimer's and dementia. So it would be it would be aside from that. So when we talk about sudden change, our doctors will look at that, and our assessors will look at that and see if there is a cognitive change or a cognitive disruption in their behavior with a different association. So, excuse me. So that's what they look at. So suicidal and homicidal thoughts, just going back up on the top of the slide, basically, they've thought about it, they've talked about it, they've voiced it. And so that's what the mental health providers and your EDs will look at, your PCPs will look at if they're voicing anything that would cause them to want to commit suicide or commit any kind of homicidal actions. So, okay. So what do we have? What are our goals for treatment? So basically, we want to stabilize the symptoms and behaviors. Basically, that's the initial, plan, the treatment for them. Also, medication adjustments and management. Sometimes we have patients that are not compliant with their medications, or the medications aren't sufficient enough anymore. So they go back in, and we come in here and we work with them. The physician will assess them, talk to them, and see, if they need any kind of medication adjustment, or maybe they're just not compliant and they need to be managed and get stabilized in that situation. So coordinate and prepare a sustainable discharge plan so that patients may return to the least restrictive supportive environment. Relapse prevention, emotional management and coping skills. That's really important because, you get the patient, they come in, it's a short term, again, it's like for 7 days, up to 10 days. It's a short-term situation here, inpatient. And so, they go back out into the community. So we want to make sure that they're able to cope out into the community. And that's why it's really important that they follow up with, in outpatient therapy as well. So that we don't just, get them fixed up, but they actually go back out and are able to come back and develop more coping skills and how they can handle or deal with everyday stressors. I like to compare it to, and here what we usually like to compare it to is like a total knee replacement. You know, you get your total knee replacement and it's fixed and it feels better, but when you go out, you have to get used to that new way of walking, moving around. So what happens after a knee replacement? You go into rehab, and that rehabilitation to be able to get you back to where you need to be so that you're functioning at full capacity. And that's basically how we feel about our outpatient services after they've been in our hospital. Also develop healthy habits and nutrition education. That is also part of what we do. Sometimes they need to learn how to take care of themselves and to eat properly. Right here at, and I know I'm going to go into this in a little bit, but we actually have a dietitian that works with the patients, especially like if they're diabetic or they have heart issues. You know, they make sure that they have a great cardiac diet or a renal or diabetic diet that is healthy for them. And not only do we provide that, but we also teach them to continue that when they go back into their normal daily routine. And again, maintain, in addition of, you know, to that, maintain their personal independence. So really, really important. That's our goal, to be able to get them to a point where they feel that they can handle, again, their stressors and everyday life independently, of course. So what do we offer? Again, clinical services and programs. We have trauma-informed care. We have group, individual, and family therapy, medication management, comprehensive diagnostic assessment, individualized treatment plans, daily therapeutic activities. We have an in-house physical, he's a recreational therapist. That's what he's called. And he actually works with the student, with the patients. We have an indoor gym that they'll go in, you know, maybe they're playing basketball or any kind. We even have little stations where they can just go and color, anything that will help them have any kind of therapeutic activity is what we have within that gym, and provides them, you know, it's part of their programming and their therapy and their treatment to help them stabilize and get to that point where they are healthy enough to thrive. Okay, and then we have family and caregiver education, which is really important, so that, because we do have a lot of family members that are not aware of how to speak to their loved ones because of the fact that, you know, it's new to them. They're not doctors, they're not therapists, and they need that education to be able to coexist with their loved ones. We do have a 24-hour nursing supervision. We also have also technicians that are supervising them as well. So one thing I do want to specify, and we always make sure that the community is aware of this, but we're not a med surge, so we don't have a lot of the capabilities that hospitals do, because we can't provide, you know, an IV or so, or any kind of ongoing medical treatment. I mean, we do take care of some things, but, you know, like I said, we do have that nursing supervision, but we don't have that, you know, any kind of med surg capability to continue any kind of ongoing, like sometimes we have people with patients that, you know, they're cutting themselves and, you know, they need to get managed first at the hospital or with a PCP before they can come in and continue their treatment. So, again, we do have that nursing capability. Also recreational therapy, and I had already gone into that. Stress management skills. which is of the utmost importance, again, because of stressors like, I talked about COVID, even the hurricane that just hit, those are things that are stressors. Any kind of global events, local, statewide, anything that can cause any kind of fear can become a stressor for them. So the clinical team here teaches them to manage that stress individually. So who is our team? So we have a psychiatrist. First of all, again, I do want to stress that we do have it. We are a hospital, so we do, as a clinical hospital for behavioral health, we do have our CEO. His name is Arlen Wickel, and he just came on board with us a few months ago, and he's amazing. We do have a CFO. We have our director of nurses, and we have a whole administrative team. Aside from that, for the support of the patients, our team, we have psychiatrists, we have licensed therapists, psychiatric nurses who are, and I specify, I stress that because these nurses know how to work with behavioral health patients, which is really, really important. We have discharge planners. So the discharge planning, we don't just send the patient back wherever. We make sure that they have an appointment, that they continue. Again, first of all, we see if they're, if they're agreeing to our outpatient services to continue their therapy. Also, we make sure that if they have a therapist or a PCP, that they follow up with that particular physician when they leave here. We even make sure that they have an appointment, and they're fantastic. They're really great about that. We don't want to just throw them back into the community. We want to make sure that they are set in the right path, and that they can make it back into their environment safely. We have mental health technicians. Mental health technicians are throughout our units. One thing I did not mention was we do have 4 units. We have an adolescent unit. We have what's called an acute adult unit for the high acute patients. We also have a unit for the adult units, and then we have a unit for geriatrics. And we do have mental health technicians that are in each unit, and they monitor each patient. They check up on them every 15 minutes. So we have continued ongoing supervision of our patients for their own safety and for the safety of others. As I mentioned earlier, we do have a dietitian, and the dietitian again monitors their diet while they're here, and also teaches them how to continue a diet, a healthy diet after they leave our hospital. And we have patient advocates. Patient advocates are really important to make sure that they're reaching their goals while they're here, and that they continue striving for their goals while they're out of the hospital. And that is our team. We also have, like you all met Myrna right now. I have 3 community liaisons, one in the Cameron, Willacy area, one in the Hidalgo area, just in case you have family up there that may be looking for someone for their loved one. We have someone there as well. And then we have a liaison in the Corpus area that works all the counties and provides information up there and community awareness for Palms Behavioral Health. So it is a fantastic team. We do work cohesively together for the patient, and the ultimate goal is that the patient receive the utmost help as much as possible from the treatment that we provide. So for admissions, which is really important, because I know that's pretty much not just knowing about our hospital and what we provide, but one of the most important things is how can a patient that is lost or looking for help come to our facility or our hospital? How can a family member help their loved one to get help at our hospital? Well, first of all, one of the things for admissions is, there's certain criteria. there's imminent risk for self-injury, imminent risk for injury to others, which is, you have the suicide ideations and you have the homicidal ideations that you look out for. Acute and serious deterioration from patient's baseline, which is the ability to fulfill age-appropriate responsibility and management of activities of daily living. So basically, they're just not functioning in their environment anymore. Also, patient who can benefit from psychiatric intervention treatment to decrease or manage presenting psychiatric symptoms. And then, as I've mentioned earlier before, you have patients that are, maybe they have a need for detox. Then we can also look at the criteria and assess the patient as well. There is a very simple process to what we provide. Basically, we have 24-hour assessments 7 days a week. There is never a time when you can never call and we're not available. We always have somebody available. And again, all you do is you have to call our hospital and our assessors. We have intake, which is, and it's called the assessment and referral team. And basically what they do is when you or a loved one or anybody who calls in needs information, we'll take that information down. And then if the patient can come in for the assessment, the patient can call over the phone, but we're there to take all the information. You can come in as a walk-in as well. Again, our doors are open 24/7. And our intake department will basically just do that. They will make sure that the patient is taken care of, family members taken care of, and they will handle all your questions. Any questions that you have, they will basically answer each one individually. If for some reason the patient does not meet criteria for the inpatient, again, we have outpatient services that they will refer the patient to. And they also are very, very well informed about where, if for some reason Palms is not a fit for them, then they will find a location where they can refer your loved one to. So again, and there's the number on the screen. If y'all want to write it down, 956-365-2600. Okay. What are the barriers in mental health in Hispanic culture? A lot of it is identity. A lot of us are raised in homes where they don't believe in an actual mental health situation. Maybe, and I mean, I grew up in Brownsville, so, sometimes there's a lot of stigma that's attached to mental health. And so because of that, because sometimes people don't believe in mental health, it puts a barrier not just on the person themselves, but on the people that are around them. So if they feel that there's nothing, what's the question? I mean, how can I put it? So if they feel that there is no truth behind a true mental health issue, then it's hard for people to reach out. So one of the things that we want to make sure, and that what we present in schools across the valley, to our law enforcement, that mental health is very real. And identity and culture, really, there is no respecter of culture identity. It just happens everywhere. And I know that when Jackie had mentioned in the beginning, yes, it's very, very true. There's nobody that, mental health is a true illness. And sometimes, there's not enough information about it, or there's not enough, people don't inform themselves enough or educate themselves enough to understand that mental health is an actual diagnosis, whether people are bipolar, schizophrenic, psychotic, there's issues that take place. And so, you know, and it's really sad because people don't want to get help because then they feel that it's going to leave a mark on them per se. They're going to be known as the person with a mental health issue, which is really sad because a lot of people need, you know, they need this help. And there's a lot of people crying out for help. There really are. You know, it's important to see the signs, and a lot of these signs we just miss. So that's why I revert back to calling our hospital, because a lot of that can be explained. So if you have a family member, loved one that is experiencing certain things, you know, they don't seem like themselves, or they're saying things like, you know, I want to kill myself, please call our number and talk to an assessor. Talk to someone from our intake, because they truly can help your loved one. They can really, you know, they can identify things. They can, we work with Columbia, which is our, you know, it's our mental health identifier. And so it really truly can be a life-saving experience for someone. So legal status, I mean, it just really depends on the situation. And so it's something that you have to consider the situation of the mental health crisis before anything else, and then move on to the next concern. So, and again, you know, it is a stigma, and it's been a stigma for many, many years, not just in this area, but in a lot of areas. I mean, it's just to me, it's a nationwide, that I've seen personally, it's a nationwide stigma. However, I mean, how many of y'all out there have someone who's been diagnosed with bipolar? How many of you out there have a loved one who's been diagnosed with schizophrenia or any kind of severe anxiety or depression? It's very, very real. It's very, very true. And the severity of it, when it becomes a crisis, you need somewhere to go to. And so Palms is just ready to work with y'all, your loved ones, your loved ones, whoever needs help out there. And we have, again, we have a great staff that is here ready to work with you all. Just a little information about who the higher risk groups are. First of all, excuse me, in the age 10 to 24 group, 81% of the suicide deaths were males and 19% were females. Cultural variations also exist in suicide rates, so that's just something to consider. Native American, Alaskan, excuse me, let me just move this up a little bit. Native American, Alaskan Native youth have the highest rates of suicide-related fatalities. And these are just statistics. These are statistics that we have off of our Jason Foundation information. So, and I can also give you some more information regarding that after I provide you with the statistics. Caucasian youth have the second highest rates of suicide. African American youth have the third highest rates of suicide. Hispanic youth are more likely to report having attempted suicide than their Black and white non-Hispanic peers. The LGBTQ youth are often considered to be at higher risk for suicide than their heterosexual peers. So 81.9% of LGBT students have experienced harassment at school because of their sexual orientation. 63.5% have felt unsafe at school. And 60.4% of LGBT students never reported an incident of harassment or assault to school personnel. So why do we provide all this information? Not to specify a specific ethnicity or race. It's to provide the information to the public that these are the groups to look for that have the highest rates. And this information is really important also for educators, people who are in education, people who are in, you know, in the school system, really important, because suicide's very real and it happens, you know, when we're not looking. So just some statistics for y'all to consider. So again, you know, so how do we overcome How do we overcome mental health stigma? Well, first of all, overcoming mental health stigma can be overcome by just stating that there is an issue. You know, we have to see that there is an issue, that it's okay to have, that it is okay to have a diagnosis, to have, you know, these situations, to have a health issue. You know, some people have diabetes, other people have suicide ideations. I mean, it's the need that needs to be met. And if we look at mental health as a diagnosis and that can be treated as something that is, I don't want to say it's common or normal, because, you know, it could be, I could be saying that incorrectly, but it is something that's very real. And I think that when when it's recognized and people are given, you know, the people surrounding them can be okay with dealing with it, I think that that's when, you know, we can start dealing with the stigma that mental health is not something that's a bad word. It's just something that needs to be, it needs to be treated and looked at, and providing the compassion to those patients that seriously need help. And I think that's a start with overcoming mental health stigma. I know that a lot of us out there never really, sometimes we don't really want to talk about it. Sometimes it's things that we keep in the dark. And I know that as soon as it comes to the light and it's able to be dealt with, and it's not so much a bad word, I guess, then that's where people can start healing. And that's what we want. We want people to heal and at least get started and know that there are other people like them that need help just as much. Okay, so before I move on, I just want to give Myrna a little bit, see if she has anything she wants to add.
Hi, good morning, everyone. I did see that there were some questions on the side, and one of them, I know Belinda already talked about it. If one needed to be referred through a doctor, no, you don't. You can just call us 24/7. You can refer a family member, you can refer yourself, you can just walk in, or your physician can refer you. So there's multiple ways to be referred to POMS. The assessments are absolutely free. You don't have to worry about insurance. And if you don't meet criteria for any of our programs, one of the things that I do is I go and I research what services are in the community that are either free, or if you need insurance for them, and I provide it to the intake team. That way, if you need something in Brownsville, in Harlingen, San Benito, they can give you that information for free as well. So do not hesitate to call. I am not a counselor, but our intake team, they are master level clinicians. So they are the experts. I always tell people, call the number. They can answer any questions you may have, because I don't know that and I don't feel comfortable answering that. And then there was another one regarding community resources. And if we only take insurance, we do different types of things. We also work closely with the Mental Health Authority in order to be able to provide these services. So don't be scared, just call and we can figure something out with the patient and the family.
Yes, thank you so much, Mira. Yes, that's a very, very valid point. Don't let anything hold you back as far as insurance or anything like that, because we do work with, again, just like Mira just mentioned, the mental health authorities, and we do find resources to help you out. One of the main thing that the main point we're trying to get across to y'all is just call us so that we can start the process of helping your loved one. I have not seen the questions. Let me go to the, let's see. I'm trying to get to the questions, Danielle. Can you read another question out for us?
So the questions were already answered by Myrna.
Okay.
If anybody else has a question, please feel welcome to use the Zoom chat or the Q&A feature to remain anonymous. And we're also monitoring the Facebook comment section.
Okay. Alrighty. So they're basically answered. So I'm really honored that we can be a part of this, especially in the Brownsville area. Thank you so much. As Myrna said, you know, we're not therapists, we're not doctors. We're just providing the community with awareness. You know, the most important thing is to call us. And I know that if you have not written it down, or if it's not provided on, I'm not sure if it's on Facebook, Danielle, but I'm just going to give you our number one more time. It's 956-365-2600. It's a very important number. Hang on to it. That's the number to call. There's no other, there's no, what's the word? There's no extension. There's no magic number. That's the number to call. So, because we get a lot of that. Well, is there another number? No. That's the number to call. We appreciate you giving us a chance to help not just you or your loved ones. So thank you again.
I also wanted to talk a little bit about the Jason Foundation. They are the most comprehensive nonprofit suicide foundation in the country. We do a lot of presentations to the community, especially to the schools. It's mostly on youth statistics and some of the risk factors on what can lead them to possible suicidal ideations. This presentation, I do a lot with smaller groups, nonprofits. I go into the schools. I do this presentation for counselors as well as for the parental involvement. And if there's any group that you think would benefit from this presentation, you can reach out to us at that same number and we could set something up. I know right now with COVID, it's very hard, but we have been doing them via Zoom. So that's also an option and it's absolutely free. And then we give you access to other videos that you can watch at home. And there's apps for your phone that are free that you can have access to, which will have hotline numbers for the suicide or our information as well. So that's another option in case you would like something for a group, Girl Scouts, Boy Scouts, any group we have been able to facilitate this presentation for.
Yes, thank you so much, Myrna. And Myrna is, she's always in the JFI newsletter, so we're really proud of that. She's just fantastic at that. She does a lot of it for the law enforcement, and they just love that presentation. It's a lot of great information, and like all the statistics that were provided beforehand, it's just a fantastic resource, especially for schools as well. Let's see. So any other questions?
We do have one question from our immediate past chairwoman of the board, Monica. She's asking, the coronavirus outbreak and the social distancing measures now in place to prevent its spread have turned all our lives upside down. But if you have a mental illness, the pervasive climate of anxiety, stress, and isolation may be especially harmful to our well-being. Can staff and employees call for help with you all?
Absolutely. Absolutely. So you're talking about, okay, so the question is, can staff and employees call, which anybody can call our number. Is that who you're referring to? Just any staff and employees? I'm not.
Yes.
Okay.
So I believe she may also be talking about maybe a group presentation to staff and employees, which I believe.
Oh, yes. Yes, absolutely. We welcome presentations to any organization, agency. That's, you know, that is our passion, to just bring awareness to the community, to any, we would love to work with employers. Yes, absolutely. Any other questions? Okay, so thank you so much again for having us. It really is an honor, and we really would love to provide presentations, as Myrna was saying, to anybody. You know, this is pretty much how we provide awareness in across the Rio Grande Valley. And just please reach out to us whenever you need us. Thank you.
Thank you, Belinda and Myrna.
Yeah, thank you, Belinda and Myrna. We want to thank you again for taking your time out of your busy schedule and speaking with us on this topic and giving us more information about that's needed in the community.
Absolutely. Absolutely. Thank you so much for having us.
Jacqueline, I believe you're on mute.
Yeah.
There we go. Can you hear me now?
Yes.
Thank you, ladies, so much for an educational and wonderful presentation. Everyone on Zoom and even on Facebook, we invite you to follow us on social media platforms and join us at next month's Wellness Wednesday, scheduled for Wednesday, August the 26th, 2020. So mark your calendars to discuss National Immunization Month. And finally, we couldn't possibly conclude the event without recognizing the support and the hard work of the Brownsville Chamber staff. Thank you so much, Danielle, for your hard work and dedication in helping us coordinate this presentation. And of course, thank you so much to my Health and Wellness Committee co-chair, Kendra Stein. Kendra, thank you so much for being here and helping me moderate. And to everyone on Zoom and all that joined us on Facebook Live, thank you so much for joining us. This concludes our program, and have a great and blessed afternoon.